Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, NHSN 2023 Patient Safety Annual Facility Survey forms, along with the respective tables of instructions, are available for completion. Deadline to complete surveys is March 1st, 2024. Users responsible for submitting annual surveys should review the forms before accessing within NHSN, as they may need to consult with other members of their organization to complete certain questions. Links will be posted to access blank copies and instructions for each 3 annual facility surveys for the patient safety component. Reminder, facilities participating in CMS's QRPs, the deadline to submit 2023 Quarter 3 data is February 15, 2024. Find more information at the links below. Next up, SNF QRP session, possible expansion of MDS data submission SNF patients regardless of payer. CMS published a summary report covering the virtual listening session held on August 29, 2023. The purpose was to seek feedback from administration and management staff, software vendors, and clinical staff on the possible expansion of collection, submission of MDS data used for SNF QRP to include residents receiving short-term skilled care in the SNF regardless of payer. Summary provides overview of presentation, stakeholder input on each discussion question, and key findings. Reports can be found on SNF QRP measures and technical info page at cms.gov. Next, U.S. prescription drug prices nearly triple those of other nations. Americans pay nearly 3 times as much for prescription drugs as residents of other nations. Prescription drug prices in the U.S. average nearly 2.8 times more than those seen in 33 other countries. Brand name drugs are even more expensive, with U.S. prices averaging 4.2 times higher than those in comparable nations. On the other hand, Americans receive a real bargain when it comes to generic drugs, with those running about 2/3 or 67% average price found in comparable countries. Generics account for 90% of prescription drugs sold in the U.S. Across all nations' studies, total drug spending was $989 billion in 2022. The U.S. accounted for 62% of money paid to drug companies, even though the U.S. gets large discounts for brand name drugs, almost 3 times higher than those in other countries, and prescription drugs account for more than 10% of all healthcare spending in the U.S. Find more information on prescription drug prices at usnews.com. Next in nursing home news this week, bill to cap agency worker charges and increase oversight grows support. A bill to increase regulation over temp staffing agencies and legally cap charges to nursing homes advanced through the Iowa Legislature Committee last Thursday. The proposal earned support from the state LTC leaders as it could help nursing homes reduce rising costs of care amid the national staffing crisis. Iowa's HHS would publish the legal cap in September of 2024. The cap could not legally exceed 150% of the statewide average paid to nurses in the same category the previous year. It also requires staffing agencies to register annually with the Iowa DHHS, or they would be prohibited from contracting with state healthcare providers. Agencies would be barred from preventing workers from being hired permanently by facilities or charging workers fees and damages for becoming full-time employees. Policymakers back providers. On average, nursing homes paid over 3 times as much for agency staffing in 2022 than in 2020. Without further reform, out-of-control costs will continue to drain taxpayer dollars and assets of state residents. The bill is the latest example of state lawmakers attempting to rein in labor costs for nursing homes and establishes what staffing agencies may charge. It's part of a growing tide of similar bills around the U.S., including at least 11 proposed state measures under consideration in 2023. Regardless of the bill's future success, Iowa's state government has taken LTC funding seriously, passing $15 million in new funding for nursing homes in 2023, and by some metrics, Iowa is already one of the best states in the nation for elder care. To get more information on this, visit mcknights.com. And last but not least, senior living seeing better than expected momentum. Senior living occupancy fell short of expectations last year. The first half of 2023 was sluggish. recovering 85% of its pre-pandemic occupancy by year-end, and expected to continue to tick up this year. Noting changing demographics, increasing number of adults aged 80 and older, savings, affordability, and health and lifestyle trends involving older adults today, more than 40% of seniors can afford to pay for senior housing through income without having to dip into savings. But wage growth in senior living has begun to level off, overall, as wages adjusted for inflation have improved over the past 6 months. A challenge for investors was noted, though, as property values declined 20 to 25% since late 2021. Prospective private market returns for senior housing seems attractive relative to other property sectors, and investors buy properties at higher initial yields with stronger intermediate-term net operating income growth prospects. For more information, visit mcknightseniorliving.com. Thank you for joining News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your quality improvement needs, call the Q.